Should you get checked for PFO after a stroke? Imagine having a stroke and wondering what might have caused it. One possible factor doctors look for is a small opening in the heart called a patent foramen ovale, or PFO. This is a tiny flap-like hole between the upper chambers of the heart, present in about a quarter of adults. After a stroke, especially when no clear cause is found, checking for a PFO can be an important step. It helps determine if this small opening might have allowed a blood clot to bypass the lungs' filtering system and travel to the brain, causing an embolic stroke. Identifying a PFO can influence treatment options to help prevent future strokes. If you're under 60 and have had a stroke that looks like it was caused by a blood clot traveling through the bloodstream, your doctor might recommend testing for a PFO. This is especially true if other common causes like atrial fibrillation or significant artery disease are not present. For older adults over 60, the decision to test is more individualized because the likelihood that a PFO caused the stroke decreases with age, and other factors may be more relevant. The main way to detect a PFO is through an echocardiogram, which is an ultrasound of the heart. During this test, a special contrast called a bubble study is often used. This involves injecting tiny bubbles into a vein and watching if they pass from the right to the left side of the heart, indicating a shunt. Sometimes, a transcranial Doppler ultrasound with agitated saline is used as a screening tool. Before considering any treatment, specialists will carefully assess the size of the PFO and its features with detailed imaging. In addition to checking the heart, doctors will perform brain scans to confirm the stroke type and pattern. They may also do vascular imaging to look at the blood vessels in the neck and brain. Heart rhythm monitoring, including an electrocardiogram and sometimes longer-term monitoring, helps rule out atrial fibrillation, which is a common cause of stroke that requires different treatment. If a PFO is found and thought to be related to the stroke, closing the opening with a minimally invasive procedure might be recommended for some patients. This procedure involves placing a small device to seal the hole, often combined with medications to prevent blood clots. However, PFO closure is not suitable for everyone and carries some risks, such as a small chance of causing irregular heartbeats. The decision to close a PFO depends on individual factors, including age, stroke characteristics, and overall health. It is important to remember that PFOs are common in the general population, and not everyone with a PFO will have a stroke caused by it. Doctors follow guidelines that emphasize thorough evaluation to rule out other causes before linking a PFO to a stroke. Sometimes, even after closure, ongoing monitoring and medication are needed to reduce the risk of future strokes. In summary, getting checked for a PFO after a stroke is often recommended for younger adults with no other clear cause, especially if the stroke appears embolic. This involves a combination of heart imaging, brain scans, and heart rhythm tests. The goal is to understand whether the PFO played a role and whether closing it might help prevent another stroke. Always consult with a stroke specialist or cardiologist who can interpret these tests and guide personalized treatment options. Remember, each case is unique, and medical decisions should always be made in partnership with healthcare professionals.